If you're over 60 and struggling with bloating, discomfort, or digestive issues that seem to get worse at night, what I'm about to share might change everything. There's a reason why Japanese elders have some of the lowest rates of digestive complaints in the world, and it has nothing to do with genetics. It's 5 simple movements they do before bed that most Western doctors never talk about. And I've seen what happens when people ignore their gut health at night. The consequences can be devastating. I'm Dr. Helen Brooks, a gastroenterologist with over 20 years of clinical experience, and today, I want to share something that's been transforming my patients' lives. These aren't just stretches or exercises. They're specific movements based on understanding how your digestive system actually works during sleep, and why nighttime is the most critical window for gut healing. Before we dive in, if you haven't subscribed yet, I strongly recommend hitting that button and turning on notifications so you never miss another health tip made especially for you. If you find this video helpful, please leave your questions and video suggestions in the comments. I read every single one, and it helps me create more content to help people just like you. Now let me tell you about Margaret, a 72-year-old retired teacher who came to my office 3 years ago. She'd been suffering from what she called her nightly torture. Every evening, like clockwork, her stomach would bloat so severely she had to change into loose clothing. The pain kept her awake for hours. She'd tried everything, every probiotic on the market, dietary changes, medications. Nothing worked. She was exhausted, frustrated, and honestly, losing hope. What Margaret didn't know was that her evening routine was actually making everything worse. And she's not alone. I see this pattern constantly. Here's what most people don't understand. Your gut has its own nervous system. We call it the enteric nervous system, and it's so complex that scientists sometimes refer to it as your second brain. During the day, your digestive system is in active mode, processing food, absorbing nutrients, dealing with stress. But at night, something magical should happen. Your gut enters repair mode. This is when inflammation decreases, when the gut lining heals, when beneficial bacteria do their most important work. But here's the problem. For most people, especially as we age, this nighttime healing never happens. Why? Because tension, poor posture during the day, and lack of proper movement before bed keep the digestive system in a state of stress even while you sleep. The Japanese have understood this connection for centuries. These 5 movements aren't random. They're specifically designed to activate your parasympathetic nervous system, the rest and digest mode, improve blood flow to your digestive organs, release physical tension that blocks proper gut function, and prepare your entire system for deep, restorative sleep. And the science backs this up completely. Let me share what happened with Margaret. When she started doing these movements every night before bed, within just 2 weeks, her bloating decreased by about 60%. Within a month, she was sleeping through the night for the first time in years. But more importantly, her entire relationship with her body changed. She told me, "Dr. Brooks, I finally feel like my body is working with me, not against me." That's what I want for you too. If you're still watching and finding this valuable, comment yes below so I know you're following along. The first movement focuses on something most people never think about, releasing tension in your diaphragm. Your diaphragm isn't just responsible for breathing. It sits right on top of your stomach and intestines, and when it's tight, which it is for most people after a day of shallow breathing and stress, it literally compresses your digestive organs. Imagine trying to do your job while someone's sitting on top of you. That's what you're doing to your gut. Here's how you do it. Lie on your back with your knees bent, feet flat. Place both hands on your upper abdomen, just below your rib cage. Take a slow breath in through your nose, and as you do, consciously push your belly out against your hands. You should feel your hands rise, then breathe out slowly through your mouth, letting your belly fall. But here's the key. On each exhale, very gently press your hands down, creating a soft massage effect on your upper digestive tract. Do this for 3 to 5 minutes. Let me tell you about Robert, 68 years old, who spent his career in high-stress finance. He came to me with severe acid reflux that was so bad he was afraid to lie down at night. He'd sleep propped up on 3 pillows, which of course created its own problems with neck and back pain. Robert had been on proton pump inhibitors for years, and they helped, but he hated being dependent on medication. When I taught him this diaphragmatic release technique, he was skeptical. He said, "Doctor, I've tried breathing exercises before. They don't work for me." But I insisted he give it a real try for 2 weeks. The difference was remarkable. You see, Robert's diaphragm had been chronically tight for decades. Every time he felt stress at work, he'd hold his breath or breathe very shallowly. This created a vicious cycle. Tight diaphragm, compressed stomach, more acid reflux, more anxiety about the reflux, even tighter diaphragm. By spending just 5 minutes each night consciously releasing this tension, Robert interrupted the cycle. Within 3 weeks, he'd reduced his medication by half. Within 2 months, he only needed it occasionally. He told me, "I never realized how much tension I was carrying right here, pressing on his upper abdomen. Now I feel it immediately when I start to tighten up during the day, and I know what to do about it." But if that surprised you, wait until you hear about the second movement, because this one addresses a problem that 90% of my older patients have, but don't even know about. The second movement targets your ileocecal valve. Now you might be thinking, what on earth is that? Let me explain, because this is crucial. Your ileocecal valve is located in your lower right abdomen, and it's basically a one-way door between your small intestine and your large intestine. When it works properly, food and waste move forward smoothly. But when it gets stuck, either open or closed, you get bloating, constipation, or paradoxically, diarrhea. You might also get referred pain in other areas, unexplained fatigue, or brain fog. And here's the thing, conventional medicine rarely addresses this because we can't see it on most standard tests. To work with your ileocecal valve, lie on your back and locate your right hip bone. Move your fingers about 2 inches in toward your belly button and 2 inches up toward your rib cage. You should be in your lower right abdomen. Using your fingertips, apply gentle but firm pressure in a small circular motion. You're not trying to hurt yourself, but you should feel a significant pressure there. Make about 10 small circles clockwise, then place your palm flat over the area and take 5 deep breaths, imagining warmth and relaxation flowing to that spot. I'll never forget Sarah, 75 years old, a former nurse who should have known better, as she told me. She came to my office after years of what she called her unpredictable gut. Some days she'd be fine, other days she'd be running to the bathroom constantly, or she wouldn't go for 3 days straight. She'd had colonoscopies, stool tests, food intolerance testing. Everything was supposedly normal. Her previous doctor told her it was just irritable bowel syndrome and she'd have to live with it. But I suspected something else. When I pressed on her ileocecal valve area, Sarah literally jumped off the exam table. "That's incredibly tender," she said. "Exactly," I told her. "That valve has been malfunctioning for a long time." I taught her the massage technique, and I also recommended she eliminate dairy temporarily, because dairy can irritate this valve in particular. Within 1 week, Sarah noticed a difference. Within 3 weeks, for the first time in years, she could predict how her gut would behave. She called me crying happy tears and said, "Dr. Brooks, I can travel again. I can visit my grandchildren without panic. You gave me my life back." The third movement is something I wish every person over 60 would do every single night, because it addresses a problem that gets worse with age but is completely reversible. We're talking about intestinal peristalsis, the wave-like muscle contractions that move food through your digestive tract. As we age, these contractions naturally slow down. Add in medication, which many older adults take, reduced physical activity, and chronic dehydration, and you have a recipe for severe constipation and all the problems that come with it. Here's the movement. Still lying on your back, bend your knees and let them fall to the right side while keeping your shoulders flat on the bed. Place your left hand on your left lower abdomen. Now, starting from your lower right abdomen, use your fingertips to massage in a clockwise direction, following the path of your colon. Go up the right side, across the top under your ribcage, and down the left side. Use firm but comfortable pressure. The key is the clockwise direction because that's the direction your colon naturally moves. Do this for 3 to 5 minutes. Thomas was 81 years old when his daughter brought him to see me. He was a proud, independent man, a veteran who'd never liked asking for help. But his constipation had gotten so severe that he was impacted, requiring medical intervention twice in 6 months. He was taking multiple laxatives daily, which only made things worse because they were creating dependence. His quality of life was terrible. He rarely left the house, was afraid to eat much, and had become depressed. I explained to Thomas that his gut had essentially forgotten how to move things along properly. The medications were doing the work for him, so his intestinal muscles had gotten lazy. We needed to retrain them. I taught him this massage technique and put him on a very specific plan to gradually reduce his laxatives while increasing fiber and water strategically. I won't lie. The first 2 weeks were hard. Thomas wanted to give up. But his daughter encouraged him to stick with it, and slowly, things started to change. By week 3, he had his first unassisted bowel movement in months. By week 6, he was off all laxatives completely. By week 8, he was regular as clockwork. When he came back for his follow-up, he looked 10 years younger. He told me, "Doctor, I didn't realize how much of my life I'd lost to worrying about my gut. Now I wake up, do my routine, and I know I'll be fine. I go out with friends again. I took my grandson fishing last week. That's what proper gut function gives you, your life back." The fourth movement addresses something that might sound strange, but it's absolutely critical. We're releasing tension in your psoas muscles. You're probably thinking, what do my hip muscles have to do with my gut? Everything, actually. Your psoas muscles run from your lower back through your pelvis, and they pass directly alongside your intestines. When they're tight, which they are for most people who sit a lot or carry stress in their lower back, they can literally compress your intestines, restricting blood flow and nerve signals. This is one of the most overlooked causes of chronic digestive issues. Here's how to release them. Lie on your back and bring your right knee toward your chest, holding it with both hands. Keep your left leg straight on the bed. As you hold this position, take deep breaths and with each exhale, gently pull your knee slightly closer to your chest. You should feel a stretch deep in your hip and lower abdomen. Hold for 30 seconds to 1 minute, then switch sides. Repeat 2 to 3 times per side. Elizabeth was 67, an office worker who'd spent 40 years at a desk. She came to me with a complicated picture: lower back pain, chronic constipation, unexplained pelvic discomfort, and frequent urination. She'd seen her primary care doctor, a urologist, a physical therapist, and a pain specialist. Everyone treated their piece of the puzzle, but nobody put it together. When I examined her, her psoas muscles were like steel cables. She could barely lift her leg without discomfort. I explained to Elizabeth that decades of sitting had created a cascade of problems. Tight psoas muscles were compressing her intestines and bladder, pulling on her lower back, and restricting blood flow to her entire pelvic region. It sounded too simple to her. "How can stretching my hip muscles fix my gut?" she asked skeptically. But she was willing to try because she was desperate. The change wasn't overnight, but it was steady. After 2 weeks of nightly stretching, her back pain decreased. After a month, her constipation improved noticeably. After 6 weeks, all her symptoms had improved by about 70%. She told me, "Dr. Brooks, I've spent thousands of dollars on specialists, and a free stretch that takes 5 minutes fixed what they couldn't." It wasn't just the stretch, I explained. It was understanding how everything in your body is connected and addressing the root cause, not just the symptoms. Now, if you're still with me and getting value from this, I really appreciate you. Comment yes below to let me know you're following along and finding this helpful. The fifth and final movement is perhaps the most important because it ties everything together. We're activating your vagus nerve, the master controller of your rest and digest response. Your vagus nerve runs from your brain down through your entire torso, connecting to virtually every organ, including your entire digestive tract. When it's functioning well, it tells your gut to produce digestive enzymes, regulate inflammation, coordinate proper movement, and enter healing mode. When it's not functioning well, which is the case for most people living with chronic stress, your gut stays in fight or flight mode even when you're trying to rest. This movement is simple but powerful. Sit up in bed or on the edge of your bed. Interlace your fingers behind your head, supporting your neck. Keeping your eyes looking forward, slowly tilt your head to bring your right ear toward your right shoulder. Hold for 20 to 30 seconds while breathing deeply. Return to center, then tilt to the left side. Do this 3 times each side. The key is moving slowly and breathing deeply throughout. I want to tell you about William, 79 years old, a retired pilot who came to me with what he called his nervous stomach. He'd had digestive issues his entire adult life: nausea, cramping, alternating constipation and diarrhea, and constant anxiety about when symptoms would strike. He'd been diagnosed with irritable bowel syndrome 40 years ago and told there was nothing much to do about it except manage symptoms. After decades of medication and dietary restrictions, he'd resigned himself to suffering. When I evaluated William, I found something interesting. His vagus nerve tone was extremely poor. Simple tests showed that his body was stuck in sympathetic overdrive, stress mode, even when he was sitting calmly in my office. I explained that years of high-stress flying, irregular schedules, and probably a genetic predisposition had essentially trained his nervous system to stay in alarm mode constantly. His gut never got the signal that it was safe to function normally. I taught William several vagus nerve activation techniques, including this neck exercise, along with specific breathing patterns and what we call gut-directed meditation. I also recommended he eliminate caffeine temporarily because it was making his nervous system activation worse. William was doubtful. He said, "Doctor, I've had this for 50 years. If it could be fixed, someone would have fixed it by now." But he committed to trying for 1 month. 2 weeks in, he called my office. His nurse told me he was crying on the phone. When I called him back, he told me that for the first time since he could remember, he'd had 3 days in a row without significant gut symptoms. 3 days might not sound like much, but for William, it was miraculous. By the end of the month, he was having more good days than bad days. By 3 months, his symptoms had decreased by about 80%. At his follow-up, William said something I'll never forget. "Dr. Brooks, my whole life I thought my gut was broken. But it wasn't broken. It just needed the right instructions to remember how to work properly." That's the power of understanding how your nervous system controls your gut and giving it the tools to heal. So let me bring this all together for you, because I want you to understand not just what to do, but why it works and how to make it part of your life. Your digestive system is incredibly intelligent. It knows how to heal itself, how to function properly, how to keep you healthy. But it needs the right conditions. During the day, your gut is dealing with food, stress, activity, and often improper body mechanics. At night, it should shift into repair mode. But for most people, especially as we age, that shift never happens completely. We carry tension in our diaphragm, compressions in our abdomen, an overactive stress response, and poor circulation to our digestive organs right into sleep. These 5 movements, done together for 15 to 20 minutes before bed, create the ideal conditions for gut healing. You're releasing physical tension, activating proper nerve signals, improving blood flow, and telling your entire system that it's safe to rest and repair. This isn't a quick fix or a magic cure. It's about working with your body's natural healing intelligence instead of against it. Here's what I recommend. Start tonight. You don't have to be perfect. Even if you only do 3 of the 5 movements, you'll likely notice some improvement. Be consistent for at least 2 weeks before judging results. Your gut needs time to respond and adapt. Pay attention to how you feel. You might notice better sleep first, or less morning bloating, or more regular bowel movements. These are all signs it's working. And please, talk to your doctor, especially if you're on medications for digestive issues. As your gut heals, you may need to adjust dosages. I also want you to understand that gut health isn't just about comfort, although that's important. Your gut influences your immune system, your mood, your energy levels, your brain function, and even your longevity. When you heal your gut, you heal your whole body. That's not an exaggeration. That's science. Margaret, the retired teacher I told you about at the beginning, recently sent me a message. It's been 3 years since she started these techniques. She wrote, "Dr. Brooks, I'm 75 now, and my gut works better than it did when I was 50. I have energy to volunteer, to travel, to enjoy my grandchildren. Thank you for not giving up on me when I'd given up on myself. That's what I want for you. I want you to have the energy and freedom to enjoy your life without constantly worrying about your gut. I want you to sleep through the night. I want you to feel confident in your body again." And I know that's possible because I've seen it happen hundreds of times with my patients. If you found this video helpful, please hit that like button and share it with someone who needs this information. Leave a comment below telling me which of these 5 movements you're going to try first, or if you have questions about your specific situation. I read every comment and often create follow-up videos based on your questions. Remember to subscribe and turn on notifications so you don't miss future videos where I'll dive deeper into gut health, sleep, and healthy aging. Most importantly, please remember that this information is educational. It's not a substitute for personalized medical care. If you're dealing with severe or persistent digestive symptoms, please see a qualified healthcare provider. Your gut is trying to tell you something, and you deserve proper evaluation and care. Thank you for watching, and here's to your health and healing. Good night, and take good care of your gut. It's taking care of you.